I take care of a lot of pediatric patients, and often the question comes up from parents, what about a fever? What should we do if our children get fevers? I want to tell you a little story about my sister. My sister is also in the medical field, but had always done the ibuprofen, Motrin rotation if her child got a fever. And so she called me one night and she said her daughter, who was 8 at the time, had spiked a fever. It was about 102. My sister was a little nervous, kind of freaking out on the phone. And she said, what do I do? And I said, well, what is she doing? And she was sleeping, but my sister said that my niece was moaning and, very uncomfortable. And I said, well, don't wake her up. Just let her sleep. Her body's doing what it should. And so she called me back and she said, it's up to 103. What should I do? And now I thought I was going to have to go over and medicate my sister at this point because she was so nervous that my niece's fever was 103. But my niece was sleeping through it, just moaning and uncomfortable. I said, let it go for another hour and call me if it doesn't break. Well, about an hour and 15 minutes later, almost to the minute, she called me and she said, her fever broke. And I said, that's perfect. Her body did exactly what it should. Well, what was really interesting is she called me the next day and she said, she's up playing and completely back to normal. And I said, that's what happens. And she said, no, you don't understand. Normally when I do the Tylenol and ibuprofen, she's down for a good week to 2 weeks. And so I explained to my sister, as I'm going to explain to you now, the purpose of a fever. First of all, the body mounts that response because bacteria and viruses cannot live in an environment where the temperature goes that high. So that's one way the body handles bacteria, viruses, whatever it's dealing with. And the second reason is because the body turns on certain immune function when the body temperature rises to a certain degree. So we have two different approaches that the body uses to help heal itself. And so when we keep taking those fever reducers, we're actually prolonging the illness and working against your body. So I always tell parents, let a fever go. I have them text me if it gets to be about 102 so that I'm aware of what's going on. But let the fever go, get it up pretty high, the body will do its thing, and then kids often recover. Now that does not apply to babies. So if they're under 1 year old, that's kind of different rules. So we don't do that with our little teeny ones. But if your child's over 1, a good healthy fever is just that healthy.